Hi, welcome to our webinar, Knowing the Best of What's Out There, Understanding and Identifying Evidence-Based Practices in Child Welfare. My name's Blake Zimmett. I'm a training coordinator here with the California Evidence-Based Clearinghouse for Child Welfare, and I've been on the project for about a year and a half now. I worked in San Diego's child welfare system for 5 years as an emergency response social worker investigating allegations of abuse and neglect. In 2008, I was employed as a full-time bilingual therapist, trauma therapist here at Rady Children's Hospital Chadwick Center in the trauma counseling program. And I'm experienced in such evidence-based practices as trauma-focused cognitive behavioral therapy, TFCBT, and parent-child interaction therapy, PCIT.
Hi, this is Cambria Rose Walsh, and I'm currently the project manager for the California Evidence-Based Clearinghouse, or as we affectionately call it, the CEBC. I have been working on the project for the past 4 years, and I'm very excited to share with all of you this wonderful resource that my team has created. Before working on the CEBC, I was a therapist in the mental health clinic here at Chadwick Center for Children and Families at Rady Children's Hospital in San Diego. And from that work, I was trained in TFCBT, which is one of the practices rated a 1 in the CEBC. And I am currently a trainer on this particular practice. Thank you again for joining us today. I will now turn this over to Blake, and he will begin our presentation.
So we'd like to get a good sense of who's out there in our audience, our participants today. And so by doing this, we'd like to take a quick poll here, and we'd like to know what would best describe you. So if you could take a moment here and provide us with your answer, whether or not you would describe yourself as child welfare administrator, child welfare researcher, community-based organization provider, administrator, CPS worker, just a webinar junkie, someone who's just happy to be on any webinar that might be out there, parent advocate or other. And so now it seems as though all our results are in. And we have a majority, 34% community-based organization provider administrator. Okay, and 21% child welfare administrator, 12% child welfare researcher. Seems like we have a few webinar junkies, some child welfare, child protective services worker, some parent advocates, and then other. All right, thank you very much. And we would like to take one more quick poll and just get a sense of whether or not you've visited our CEBC website before. So if you could let us know either by yes, no, or not quite yet. And we'll wait a couple moments here for all the results to come in. And it seems like many of you have visited our website before. And this is great. So hopefully this will be helpful and still give you some great information and show you how the different ways it can be used as a resource and a tool for you. And 7% have not, and 12% not quite yet. So I'd like to move into our objectives here. And what we're hoping to accomplish today. We just want to, I'm hoping that everyone will understand the purpose of the California Evidence-Based Clearinghouse for Child Welfare, the CEBC, and the importance of evidence-based practice within the field of child welfare. Learn more about the process the CEBC uses to rate programs as evidence-based, and identify and determine evidence-based practices relevant to child welfare. And there's a quote I really like here. It is easier to build strong children than to repair broken men. I think this is really what the project has set out to do. And we want to provide the best information out there for child welfare professionals, and as well as the clients, the families, parents, and children that we're out there serving. We want to get this information out there to help all of them. So, and I think sometimes when we talk about evidence-based practices and outcomes and um, different randomized controlled trials, things of that nature, uh, sometimes we might lose that what we've really set out to do, that is work and help these children and families out there. So uh, what I'd like to go into now, just briefly, in speaking a little bit more about the importance of evidence-based practices, is, and you'll see I do have a thing for quotes. Although the world is full of suffering, it is also full of overcoming it. And I like to think of this in terms of, when we do think of all the different ways in which we can work to make many of these children's wishes come true, we have this ability now to accurately test and evaluate which programs and interventions actually work out there. And in turn, we're able to lessen or even end the abuse, maltreatment, or neglect taking place within some of these children's and families' lives. And with this ability, or responsibility even, we're able to help to do our parts in trying to turn these children into strong, healthy, happy, and well-balanced adults. So a great example of this is the ACE study. One of the largest investigations ever conducted to assess associations between childhood maltreatment and later life health and well-being. Dr. Vincent Folletti found that there was a clear and evident correlation between an individual's ACE score, so adverse childhood experience score, their childhood trauma, and the negative consequences later on in life. This was an increase in their depression, rates of suicide, obesity, drug and alcohol use, and that actually shortened one's lifespan. So really powerful study there. And I've been fortunate enough to watch Dr. Vincent Folletti present on his ACE study on 3 different occasions. And each time there's someone out there in the audience that asks him, so what can we do? What can we do to make this better, to ameliorate this issue of child abuse and maltreatment and trauma and this childhood trauma? And what do you think is the solution to the problem? And each time Dr. Vincent Folletti answers, well, there's a lack of recognition of this issue, and there needs to be a spread of awareness. And 2, we need to be putting money and effort towards prevention and research, and putting funding and energy towards finding out what really works to help these children and families. And this in turn creates the changes and the positive differences that will carry into future generations. And this really, I think, provides hope and possibility to make those dreams and wishes come true. And that gets me thinking and asking that question, is there anywhere that we can go to get help, for people who might be trying to find out exactly what programs are out there and their level of research that they have that exist at this time? Cambria, is there?
Great question, Blake. And actually, that's kind of the purpose of our webinar here today, is to tell you about a wonderful resource to help look at different practices and how much research there is for those particular practices. So we are here to talk to you about the California Evidence-Based Clearinghouse, or CEBC. This particular project began in 2004. It's funded by the California Department of Social Services and managed by the Office of Child Abuse Prevention. And it's really a partnership between Chadwick Center at Rady Children's Hospital and the Child and Adolescent Services Research Center, which is another department based here at Rady Children's Hospital. And it was launched, the actual website was launched on June 15th of 2006. And at that time, there were 2 topic areas and 17 programs. And it now has 32 topic areas and about 213 programs and continues to grow. We add 5 new topic areas each year and approximately 50 programs or so each year to the website. So it continues to grow in scope. This is our homepage. We recently redid our homepage. When we first started the website, we had much more information on the front page because nobody had been there before and needed to know a lot more detail. Now that we have a lot of return visitors coming, we wanted to restructure it to make it very easy for those people who'd been there before to get right to the information that they wanted to get to, and for those who hadn't been there to find their way and navigate their way around the website. And that's really one of our goals with this, is to make it as easy as possible because we know folks don't have a lot of time to spend searching on our website. So we really did design this website so that people who have just 5 minutes could kind of drill into it, and folks that had a lot more time and wanted a lot more information could go much more in depth onto the website and spend a lot of time looking at the extensive information that is provided. So we basically, as I said, have really tried to make it very easy access to information, easy access to understanding exactly how we review the research and rate the research. We're going to take you behind the scenes a little bit during this webinar today and tell you our process of how we get all of the information that comes onto the website. But everything was really designed with the thought that we wanted to make this a very easy to use and user-friendly resource. We provide both brief and detailed summaries for each of the reviewed programs, so you can determine the level you want. If you have 1 minute to go on the website, you just really want to get a quick idea of what a program is about, you can go into that brief summary and get a lot of very quick information. And if you have more time and you want more in-depth information, you can go into those detailed summaries and get information that way as well. Also, all of our practices are scientifically rated. We have a 5-point rating scale, which we'll be going through a little bit later on in the webinar, that we rate each of the programs on in order to give you another quick way to see how much research evidence there is for each of the programs. We have a couple of very important advising bodies. One is our advisory committee, and they are located here for the most part within California. That, along with the fact that we are funded by the California Department of Social Services, is what really makes us the California Evidence-Based Clearinghouse. But we have found the information that we have on the website is very valid to people all across the United States and in other countries as well. We've had visitors come to the website from over 190 countries, and so we know that it's being utilized quite widely beyond California, although the bulk of our visitors do come from within California. On our advisory committee, we have our California Department of Social Services represented. We also have county child welfare departments, people from the County Welfare Directors Association of California. We have representative from our California Child Welfare Training Organizations, from public and private community agencies, and then also we do have one national person on our advisory committee who comes from the Child Information Gateway and gives us kind of updates on what's going on the federal scene. The advisory committee basically, their most important job, I think, is to help us in identifying which topic areas that we want to look at, and then reviewing the programs that we come up with for each of those topic areas to give us feedback if we're missing any key ones that are being utilized commonly in California. They also have really been helpful in reviewing the products that we have, including the actual website itself, and giving us feedback in order to help us make it very user-friendly. The other important group that we have is our scientific panel. The scientific panel members are nationally recognized as leaders in child welfare research and practice, and/or they're very knowledgeable about what constitutes best practice and evidence-based practice. So for the most part, they are not located here in California. They do come from around the country, and they really help us with guiding the scientific process for the CEBC. They assist us with identifying relevant practices and research for programs within selected topic areas. They provide recommendations for our topic experts, and we'll tell you a little bit more about the role of our topic experts in just a few moments. And they also provide guidance on the scientific integrity of the CEBC products. They helped us come up with the scientific rating scale, and they continue to help us refine the scientific rating scale. And you can see who our members are here on this slide. I won't go through them individually, but they, as I mentioned, come from across the United States and have a wide amount of knowledge that they bring to this particular project. And they are led by our scientific director, who's Dr. John Landsberg, who's also the director for the Child and Adolescent Services Research Center here at Rady Children's Hospital. This is our CEBC team. This is the Chadwick side of the team, and primarily the Chadwick side of the team works on kind of the content and dissemination pieces of the project. And then the other part of our team from CASRIC, these are the research gurus, and they're the ones that help with the rating and the lit reviews and looking at the research portions of what is on the project, as well as helping us with some of the dissemination efforts that we're engaged in. All right, this leads us to another poll that Blake is going to walk us through.
So we have this poll here. We just want to kind of continue here before we dive into the website and all of its practical uses. Based off the Institute of Medicine's medical model, evidence-based practice consists of, and if you could please take a moment to answer this. We're going to open the polls now. And we'll wait a few moments between best research evidence, best clinical experience, being consistent with family and client values, or all of the above. It seems like all of the responses are just about in. All right. And it seems like we have almost 21%, the best research evidence, and 79% have answered all of the above. So, and the correct answer is all of the above. This best research evidence, all of these three concepts here together, this here is what brings us to that definition of evidence-based practice for child welfare. And many years ago, these three different components used to be looked at as separate entities, but now this is something that we really need to look at all together. And the best research evidence component, that's something that really the CEBC hopes to bring into the field of child welfare to this definition. And then the best clinical experience, that's what we're hoping all of you out there, all of our providers, administrators, social workers, clinicians are bringing to this equation. And then being consistent with family and client values. This is something that we all need to take into account when we're working with children and families. And the CBC also has worked to include evidence-based practices and cultural resources into our website. So this is something that's really important for all of us to consider, and this adaptation of the Institute of Medicine's definition, we've worked to include the importance here of being consistent with family and client values. So as we're going through this, why evidence-based practices now? This is a really good question, and this kind of goes back to what I had mentioned earlier in the presentation, that with this ability and this knowledge about whether a practice or program intervention can achieve the various goals and outcomes that it states it can, we really want that information out there. And that term, evidence-based practice, has been integrated into a lot of marketing language, and this creates a need for us to critically examine what's out there and make sure that the information is accessible not only to child welfare professionals, but to clients and families that we're working so hard to serve as well. And ultimately, it's about increasing the quality of services and programs out there, really trying to raise the bar. So this in the past, this has been something that's somewhat challenging and difficult, with evidence-based practices in the field of child welfare. Really less is known about evidence-based practices in this field than any other areas, such as like medicine or mental health. And And also, no one else is looking specifically at evidence-based practices for child welfare services and populations. It's a really unique population and definitely with some complex needs. So as demand is increasing, as seen by through RFPs, requests for proposals, and funding sources asking for evidence-based practices, we hear a lot these days that this is something that's necessary, and we really need to have it out there in child welfare. So and also during these times of fiscal difficulty, funders are highly focused on what's being used out there. So we want it to be as not only useful but as efficient and helpful as possible. And with all sorts of treatments that are out there, ethically, it's really important that we're providing services to our clients that work and are safe. And we don't want our clients or families to go somewhere else that's not only ineffective but detrimental as well. And in general, if people seeking services aren't getting what they need or seeing positive, measurable results, they very well might move on and go somewhere else. So if we don't provide this for them, they unfortunately could go somewhere that we hope that they will not go. So what I'd like to take you through right now really quick is the CEBC's process for radiance programs. So we identify our 5 topic areas, and this is done through our advisory committee's assistance, that advisory committee that Cambria had mentioned earlier in our presentation. We narrow down our program list, and the CEBC research staff conducts a general search to identify candidate practices. Our focus is on programs that have strong empirical support, are in common use, and are being marketed in California. And we review research on each program. Our topic expert assists the CEBC research staff in the selection of these practices. Then we work with the program representative to gather information. Program representatives submit information on their practices, and then we move forward and take out the marketing language and excuse me, and send it back to them, making sure that everything's good. And from there, we review and rate each program. Our topic expert and CEBC staff rate each practice, and we're very transparent in our rating system, and you'll find this in just a few moments, as Cambria is actually going to guide us through this scientific rating practice.
So next we're going to discuss a little bit about how the rating scales were developed, and also review the scale criteria and describe the rating process. So this is our current rating scale, and when we sat down with the scientific panel who really helped us in developing this, we wanted to create it on a continuum. We didn't want to have a program as evidence-based or it's not evidence-based. We felt it would be more helpful to really help illustrate how much evidence there was for a particular program. So we came up with a 5-point scale. Our 5s are our concerning practices, and our 1s are our most well-supported practice. And moving between the ratings is kind of like moving up or down a step. So a program rated a 2 is 1 step below a program rated a 1, and so on. If a program doesn't have any peer-reviewed literature or doesn't have the research evidence that meets the threshold for rating, as we will discuss further in a moment, then it's considered an NR, or not able to be rated. And I think the other thing that's important to know about our scale is that we do re-review programs, so a program could be rated a 3 and then have more research that's published and could move theoretically up to a 2 or a 1, or it could move down to a 4 or a 5 depending on what comes out in that research. So once you have a rating, that's not necessarily your rating for life. We do re-look at information that's out there and try to keep up with the research as much as possible. We do annually review with the programs themselves, asking them if they have any new research, and every 2 years we re-look at, do an independent literature review for each of the practices. In terms of our users, we also have users who've come to us and said, did you know that there's a new study out about, this practice? And we certainly appreciate that and do take that into consideration and look at any information on new research that comes in from our consumers as well. So a couple of important comments, since it may have been a little while since some of us have taken our research courses, that I want to make sure we're all on the same page. The first is to explain the peer review piece, and we do depend on peer-reviewed research for all of our scientific rating. We don't do systematic reviews. We don't go in and critically look at the research because we really need to depend on the peer review, or we wouldn't be able to add programs at nearly the rate that we've been able to add them. So peer review kind of does the same thing for science that Inspected by Number 7 sticker does for your t-shirt. So it provides assurance that someone who knows what they're doing has double-checked it. So in science, peer review typically works something like this. You have a group of scientists who complete a study. They write it up in the form of an article. They submit it to the journal for publication, and then the journal's editors send the article to several other scientists who work in the same field. So these are the peers of the peer review. And those reviewers provide feedback on the article and tell the editor whether or not they think the study is of high enough quality to be published. Only articles that meet good scientific standards, they acknowledge and build upon other work in the field, rely on logical reasoning, are well-designed studies, they have back up their claims with evidence, are accepted for publication. So we really depend on the fact that, what's in that peer-reviewed literature is good, solid science that's out there. Because as I said, we don't have the time to go through and really re-review in depth all the studies that are being done. The other important concept to know is randomized controlled trials. And this is the kind of gold standard that we use here in terms of having real solid research evidence. And in a randomized controlled trial, participants are randomly assigned either to an intervention or to a control group. And this allows the effect of the intervention to be studied in groups of people who are the same, except for the difference being the intervention that's being studied. So any differences then seen in the groups at the end can be attributed to the difference in treatment and not to bias or chance. So as you see here, they're randomly assigned into a treatment group and a control group, and they stay with that particular group to also look at follow-up, and we'll talk about that follow-up piece as we look more specifically at our scientific rating scale. So we have a 5-point scientific rating scale, as I mentioned before, and thanks to one of our scientific panel members who helped us come up with this metaphor, and we've adapted a little bit from some of the presentations that he's done on this. We really look at this in terms of kind of the solidness of evidence. And in doing that, we look at 1 being our rocks, 2 being gravel, 3 being sand, 4 being water, 5 being gas, and our NRs as having an unknown foundation. So I'll go through each of them briefly individually to give you a sense of what each of these ratings means in terms of the research evidence. So our first are our 1s, and these are well supported by research evidence. And we compared those to being a rock. And as you can see here, it's a very solid foundation to have a rock foundation. And in order to be a 1, you have to have 2 or more rigorous randomized controlled trials. They have to be published in the peer-reviewed literature. And one of those must show that the RCT has sustained effect of at least 1 year beyond the end of treatment. Our 2s, which are supported by research evidence, we represented with gravel. So not quite as strong a foundation or solid a foundation as the rocks, but still a pretty solid foundation. And in order to be a 2, you have to have 1 or more RCTs. They have to be published in the peer-reviewed literature. And one of those RCTs has to show the practice to have a sustained effect of at least 6 months beyond the end of treatment. So again, very clear, very transparent in terms of what it is required in order for you to be rated a 2. Our 3s are our promising research evidence, and they're kind of like sand. They're more likely to shift over time, not quite as solid a foundation, but they're starting to look like they may have some real promise to them. And these particular, to get a rating of 3, you have to have one study utilizing some form of control. Has to be published again in the peer-reviewed literature. Oops, sorry, clicked on that too fast. And that form of control can be various different things. It could be, it's not randomized, but you've got 2 separate groups, and one of them is getting the intervention and one of them is not. It could be a matched wait list. There's several different things that can fall into this. So this is a pretty wide category to fall into. Our next category is our 4, and the 4s are evidence fails to demonstrate effect. And our 4s we compared to water. And so they may seem, like they're going to float for some time, but in the long run, they're pretty likely to sink. And this level encompasses programs that have not resulted in improved outcomes when compared to usual care. And what we see here is that we have a preponderance of the evidence does not support the efficacy of the practice. Oops. And in this case, they have to have at least 2 RCTs that show that they are not effective in order to fall into the 4. If they've had multiple RCTs, then the preponderance or the more of them have to show no effect than showed that they did have an effect. We don't have a lot of programs that fall into this particular category, but we are starting to see a couple of them. And then our final rating on the actual rating scale is the rating of 5. And this is our concerning practice. And this we compared to gas, not a very solid foundation at all. And what we know with those is that they really just don't, like we saw that house, it just kind of floats away. There's really no evidence for it being an effective practice. And in fact, it's actually the opposite. We have concerns that it may cause harm. And for this, we look at the fact that the intervention has a negative effect upon the client served, and that it constitutes a risk of harm to those who are receiving it. And so there's, something either in the research or there's been a legal or an obvious reason to determine that this particular practice is concerning. And then finally, our last group is our NRs, or not able to be rated. And these really have an unknown foundation. We simply don't know whether they're effective or not because they lack peer-reviewed published research. And so in this case, it's time to kind of get out those engineers. These are practices that may be wonderful practices, but there's just no way to tell. And we really, encourage folks to start doing research and doing evaluation to look more closely at these practices so they can start to differentiate where they would fall on this particular rating scale. So they lack published peer-reviewed research on comparison studies. And they're generally accepted in clinical practice as appropriate for use. And essentially are not able to be rated are programs that don't fit anywhere else on the scale. They can't be rated anywhere between the 1 and a 5, and therefore they fall into the not able to be rated. So we have a couple of strengths and limitations that we've seen in terms of our rating scale. The biggest strength is that it's very clear-cut. The numbering system is very easy to follow, and people are able to really have a very clear understanding of why a program has the rating that it has. One of the limitations is that we may miss some high-quality research and null studies because we're relying on the published peer-reviewed literature. So we're not looking at dissertations. We're not looking at research that hasn't been actually published, evaluations that have happened. So there may be some information out there that would give you some input into this particular practice, but we simply don't have the ability to look at those types of studies that haven't been published in the peer-reviewed literature. A couple of lessons learned. We really have learned that the rating scale needs to be very clear, it needs to be concrete, and it needs to be objective so that people can follow. It needs to allow for changes over time as issues arise. I would say at least every 2 years, if not every year, we make some slight modifications to the rating scale because we learn more as we look at more and more programs and we see kind of loopholes that are in the scale that we have to make changes to. And again, when we make changes, we're very transparent. The rating scale is up on the website. You're able to go in and look at it. There's information about changes that have been made in the past so that you can kind of see the history of the rating scale, and because we want to be very transparent about what we're doing with it. We also realized that it was important to include all identified programs, including the non-responders and refusals. So we do have some programs that indicated that they didn't want to be on the website. Oftentimes that's because they know that they're not going to get rated a 1 or a 2, and they don't want to be up there because they don't want people to know that. And that's not a good enough reason for us. So although we don't have as much information up about programs that refuse to work with us, we do have the brief summary and the information on research and information on training and how you would contact the program to find out more. And we also realized that we needed a process for self-nominated programs. When we first started off the website and nobody knew much about us, we didn't have a lot of programs coming to us. Now that we've got a lot more programs on the website and a lot more recognition, we do have programs coming to us. And we've realized is we simply just do not have enough time to work through all these programs and put them all up there. So we've developed a process for adding self-nominated programs where we look at, are they being commonly used and marketed here in California, and or do they have research that would allow them to be rateable on our 5-point scale? And we use that as kind of a process for prioritizing which programs are going to get added that self-nominate. So I'm going to turn it back over to Blake, and he's going to tell you a little bit about a couple of other pieces that we look at and finish up the discussion of our process in terms of how programs get added to the website.
So something else that we're looking at here, we're also reviewing the relevance to child welfare. So our entire team, our staff, really takes a look at whether or not providing a different level of relevance to child welfare, whether it's a high, medium, or low. A good example of high would be a parent training program designed for parents who have a history of abuse or neglect, a history within the child welfare system. A good example of a medium could be postpartum depression treatment or a program targeting low-income single parents. It's likely that the sample would include some current or former child welfare clients. And low, something designed for populations with little apparent similarity to the child welfare population, or child welfare services population, with an example of that could be a school-based parent training program for parents of homeschooled, gifted children, designed to teach parents how to successfully homeschool their children. So, excuse me, what that leads us to here within that CEBC process that we use is this final step, that posting program information. So it's at this point where we conduct our dissemination, and the summaries and ratings of each practice are posted on the CEBC website. So just to give you an overview of what we have, as of December 2011, 218 programs in total. You'll see we have 20 that have a scientific rating of a 1, 31 programs have a scientific rating of 2, 66 programs have a scientific rating of a 3. We have 1 program with a scientific rating of a 4. We have currently no programs with a scientific rating of a 5, and this is a very good thing. And we currently have 99 programs with scientific rating of not able to be rated. So that just gives you a quick overview of what we have here. So with that, our topics currently on the website. In just a moment, I'm going to take us live through the website. But this is just to give you a quick view of what we have, and I'm actually going to show you. This is just to give you a quick overview of of the various different topic areas we have. And at this time, I'd like for us to go live on the website. So as you can see here, this is our home page that we showed you a snapshot of earlier. And we have our various different tabs here. It can lead you into what's new on the CEBC, different programs that have just been recently added to the website, as well as different tutorials that we're working on of our an overview of the CEBC, and as well as our scientific rating tutorial. We also have throughout there other instructions on how you use the CEBC, what is evidence-based practice, how is culture related to evidence-based practice, how our programs are viewed on the CEBC, and signing up to get email alerts, which we'll show you a little bit later on, which we hope all of you will sign up for email alerts. And at this point, I'll go back to what I was discussing earlier, or sharing with you earlier about our different topic areas. So I'm just going to go and take you through a quick example of a program within the topic area of trauma treatment. We have a definition for trauma treatment as it relates to child and adolescents, and also a description of why trauma treatment was chosen as a topic by our advisory committee. And within here you'll see all the different programs along with their scientific rating. So our 1s, our 2s, our 3s, and are not able to be rated. I'll take you through a 1 of our trauma-focused cognitive behavioral therapy, since that's just one of them that I'm most familiar with. And within here we have a brief description, the child welfare outcome, the different types of maltreatment that's addressing, the target population, what overall the goal of TFCBT, what kind of symptoms it's looking to address within a specific traumatic experience or experiences. And then, besides on this first page, the contact information, we have view detailed report. And so it's within here, viewing the detailed report, that you'll see, again, that brief description along with the essential components, which you can click to. And it will show you exactly what is the makeup of this model and the various components. There's also whether or not there's a child component, parent-caregiver component, if it's offered in a group format or individual format, the recommended parameters, delivery settings, whether or not there's homework offered within it, languages, the resources needed to run the program, minimum provider qualifications, education and training resources, implementation information, which Cambria is going to discuss briefly in a few moments, relevant published peer-reviewed research, references, and contact information. I want to take you through this really quick with the relevant published peer-reviewed research. We've basically gone and done all the work for you. So we've gone and taken all this extensive research that's out there, the peer-reviewed research that's available, and we've condensed it and have not only the citation so you can find more information on it if you're interested, but we've also gone and provided a summary along with the descriptions and the main information related to that particular research study. So, and then we have also gone ahead and provided not only references but the contact information in case you wanted to find out more about trainings that are offered, as well as the possible costs for implementing this kind of program within your particular area. So, and at this time, as I had said before about going through the implementation, Cambria is going to help us through that, or lead us through that. Oops, sorry, excuse me. Okay.
All right. So we'll click here. So this is, if only the road to implementation was this beautiful and this easy. Unfortunately, what we find is, the first step is to really know what the practices are that are out there and how much research evidence for them. And then the next step is making these decisions about which practice is going to be the best fit within your community, and then how do you go through and actually implement that. And I want to do another quick poll here just to give you kind of an idea of this. So this poll says the lag between the discovery of more effective forms of treatment and their incorporation into routine patient care is, on average, blank years. And your choices are 3, 5, 10, or 17. So go ahead and answer that, and we'll see what you all come up with. All right, so let's see here. We had about 6% of you saying 3, 40% saying 5, 46% saying 10, and 6% saying 17. So let's go to the actual article where this was quoted and see what we find out here. So we see here, in this part of the article, the lag between the discovery of more effective forms of treatment and their incorporation into routine patient care is on average 17 years. So this comes out of the Institute of Medicine, and so they're looking at medical evidence-based practices. But much of what we learn about evidence-based practice comes from our cousins in the field of medicine because they actually are ahead of us. And although this quote is from 2001, unfortunately, I think that while we may have shortened this time period a little bit, it's still quite a long lag between when we discover effective treatment and when we actually have it incorporated and everybody using it in terms of their interactions with clients and patients. So at this time, we're going to go live. So let me take you back live, and we will look at our implementation information again. So we have an entire section on the website dedicated to implementation. We have several resources that we've put together. And this is a section that continues to be added to, and we continue to grow as we learn more about this. The actual research on implementation is pretty early on, and it's pretty much in its infancy, although there is more studies and more data that's coming out at this point in time. It's been kind of a slow process, and when we first started this a couple years ago, there really was very little, and now we're finding there's more research, and we want to continue to add to the section, add information about the research. So we have a couple of different tools that we've added in here. One is our selection guide, and this is based on the work of Trish Greenhall and her colleagues out of the UK, and she conducted a systematic review that addressed the question, how can we spread and sustain innovations in health service delivery and organization? So she didn't look at evidence-based practice specifically, she looked at innovation. But using the key findings of this review, we've really pulled those together to design a guide to help you make critical decisions about selecting a practice, because what she found for innovation is also very applicable to evidence-based practice. So for each of the key findings that we put into this particular guide, we provide a key question that agencies should consider. We tell you where within the program outline that Blake went through with you just a moment ago, you might be able to find information to help answer that question. And we also give you an example on how that key finding can be applied in a real-world situation. So for instance, one of the key findings is match of skill set, and this question is, does the workforce possess the appropriate clinical background and education? And helpful sections of the CBC's program description include minimum provider qualifications, the essential components section. A real-world example would be that you have an agency that has an existing workforce, and that workforce is composed primarily of social workers, and they're looking at implementing a home visiting program. So despite the high level of research evidence that there is for nurse-family partnership, the decision is probably going to be made that that's not going to be appropriate because the minimum qualification for providers for NFP requires they have a degree in nursing. And this wouldn't be a very good match and skill set for the agency that already had social workers in place. So they would want to look at other home visiting programs. They may not find one that has quite as high a level of evidence, but that is going to work better with their existing workforce. So there's lots of different criteria that one needs to think through before one makes a decision about which particular practice to select. It isn't just whether there's evidence or not. There's some areas where we actually have a lot of evidence, and then you have to tease out, which program is going to fit best. There's other areas where there's very little evidence, and in those cases, then you want to look through, of the programs that are available, which one is going to fit best within our particular setting. So also within the implementation tools section, we have our implementation decision guide for child welfare. And this guide was really designed to help child welfare use a multi-level process of implementation to take into account the system and organizational context, as well as the ways that the people, systems, and organizations interact. So the implementation basics section here gives kind of an explanation and some things to think about in terms of implementing evidence-based practice. The key concepts of implementation is a conceptual model that helps you look at implementation and sustaining in child welfare. And then this last section looks at where are you on the implementation continuum and spells out the different places that you are, and you can see the phases here: exploration, adoption, decision and preparation, active implementation, and sustainment. And if you click on each of these, you'll find more information about that particular phase, what is going on during that particular phase, and then both things on the outer context and the inner context that you need to consider. We also provide information in our implementation section on programs rated at the highest level. So all the programs that are rated either a 1 or a 2 on the CBC scientific rating scale have information. This can be found in our implementation section. It also is found in the actual outlines themselves. So for instance, when we were in the trauma-focused cognitive behavioral therapy, this is in the actual outline, and this is the implementation information that's available. So we asked each program 3 things. We asked, do you have any pre-implementation assessments that are available to help measure organizational or individual readiness? We asked about implementation tools. Are there any guides, any manuals that are available? And then we asked about fidelity measures. And what we found is some programs, like this one, for instance, were able to answer all of those questions and do have existing implementation tools in place. But we also found several programs that don't have that information. So that's another thing that you want to consider as you're looking at choosing a program, is how much implementation information is available and how much implementation support is available and needed from the program itself in order to actually implement the program. Then the final thing I will highlight in our implementation section here is our implementation approaches. So we went through and actually looked at which approaches are being used either in child welfare or with populations similar to the child welfare population to implement practices. And for each of those practices, we provide a basic overview, and we provide information on where we got that from, as well as a website link to go to learn more information about that particular implementation approach. So that is just a very quick information on implementation and the information that we have. As I said, it's an area that we continue to look to add to. Over this next year, we want to add information into our implementation approach section on actual research that's been done on each of these approaches, because there is research now that has been done on some, though not all, of the approaches that we're looking at. So I'm going to take us back to our PowerPoint presentation. And Blake is going to walk us through a little bit about practical application of the website.
Thank you, Cambria. Yes, practical applications of our CBC website. Hopefully this gets at that question that so many of us often have of, so what's in it for me? What can I get out of this? And hopefully this will help in that area. Excuse me. And I think an even better question there, oftentimes when I ask that here, is, what's in it for the children and families that we're working so hard to serve here. And so as far as the area of research and academia, there's there's so many different ways, and I wish that when I was back in undergrad or even in eventually finally in graduate school, that I had a resource out there helping me, so I didn't have to do this and just stand over many, many, many books at the library. So we've, we've really sat there and we've done all the work for you. And basically, if you go to a practice and it's rated a 1 on the scientific rating scale, and you look at the relevant research section, you can learn more about the existing research established and the practice, exactly what makes it evidence-based. And for students in both graduate and undergraduate programs, it's a great way to learn more about research in easy-to-read format. And again, those citations are provided so that people can go on their own and if they want a more in-depth review. And what we've also found is that students can use a scientific rating scale developed by the CEBC to assist them in reviewing practices in related areas such as aging or mental illness, as well as those in child welfare that are not currently on the CEBC website. And what this does is provide the student with a structure to learn how to evaluate the evidence base of a wide range of different practices. And it's a great way for any of us to really examine and investigate that claim that many of these programs and interventions make is our program is an evidence-based practice. So it really gets them, it gives them that opportunity to critically look at that and examine it on their own. So as far as administrators, we felt like this could be a really good opportunity here to open this up and get your views, since we have many administrators out there and community-based organization providers, administrators. What we'd like to do here is just get some feedback from you and suggestions, comments, or what you've seen so far in ways that you feel like this could assist you in the work that you're doing with your families and children, this website. So if you could please provide us with any within this practical or through the chat box as described earlier, and we'll post them for everyone to see here within this practical uses section. And we can briefly hit on them and discuss them. So we've got some coming in already to help in guiding selection of new practices to implement. Yes, definitely, totally. And I think that's incredibly helpful right there, being able to do that. And yes, as we've talked about, connecting with funders, really being able to make those RFPs stronger and really try and get the best of what's out there for our families, to better understand the programs we have and the research behind them. Also look at new practices we should adopt for families within our community. Totally, yeah, that would be a huge help to so many different families and children out there. Perhaps only list programs with 3 or better for referral, yeah, or at least be able to see what's out there on programs that are not able to be rated at this time. Definitely, yes, help with planning and growth. Definitely, yeah. That we hope that it's really helping different agencies there and really raising that bar and making sure that the best is out there for our families and children. Use it to evaluate what practices to use, or in choosing contractors, or in awarding grants. Yeah, definitely. That's the website has been used and referred to in various grants for that purpose. That's great. Gather information for statistical data regarding programs and grant writing. Yes, we've done all the work for you to make your life easier. So So that's what we really hope to do there, and just to make programs and administrators feel a lot more effective and efficient, to find what evidence does exist to help communicate to our own staff about the background and support for their practices. Yeah, I really like that one as a therapist. That's when I was doing direct practice with clients. It's huge for that. I think it's extremely useful in that way to help their staff learn more about evidence-based programs. Yes, yeah, to help staff, to help students, all the different child welfare professionals out there, matching the best evidence-based practice uh, for that type of agency program that you're running. Yeah, definitely getting at that question that we had talked about earlier, Cambria had led us through with implementation, is that question of whether or not it's a good fit. Yeah, definitely. And yeah, oh, and okay, and that provides comparison for evidence-based practice programs at a federal level. Yes, that one's a great one too. So thank you very much for all of your contributions there. That was really helpful, and um, and that actually helps us to even grow as on our project and make it stronger and more useful in many ways. And so I appreciate all of those contributions. And so yeah, again, as we had gone through, whether or not it's you guys got it all, that the good fit, and really looking at the research that's out there, and yeah, that money, and whether or not we're um, really getting at uh, trying to get the funding for the programs that we're trying to work and implement within our communities and our organizations. So also another thing here for direct service providers, this is something else we found. It really can help them to learn more about the different evidence-based practices that exist out there. That was something that was already touched on. Links to information about training. So we found that to be something that's really helpful, and you know, basically as more information about EBPs becomes available, we have clients that may also specifically request treatments that they've read are effective, and so they're actually asking about it. And so clinicians, various different providers, social workers out there can have an easy way of showing those clients what is out there, and leading them through it, and guiding them in that way, or referring to the website for that. And also what we found, or the feedback we've gotten, if you're in private practice, many managed care companies may also push for EBPs as they decide how to spend their money, and they're more likely to pay for time-limited services that have been shown to have been effective and show sustainable results. So if you're using the CBC, it gives you an easy way to learn more about the different EBPs and provides links to further information there about, again, about manuals and training opportunities that exist. So yeah, and just really quick, others that we've found using the website, funders, something we've touched on already, students and professors. This is something that we've actually found them incorporating our professors and academia into their curriculum, their syllabus, and so that's been cool to see them actually finding ways that they can have their students use the CEBC in their different research projects, or even their even on their when they're doing their field placements, and finding out more about the evidence-based practices that are currently being used within their placement, the organization that they're interning at. Again, consumers and clients, to kind of give them a further and clearer understanding of what treatment model or intervention they're being referred to, and gives them a better sense of the treatment that's entailed, and the goals and the duration, and many other questions that they might have. They could really be answered there. And finally, what we've also found with attorneys, that they've been able to use the CEBC website to better advocate and represent their clients throughout their different court proceedings. So right now, we'd really, as we're wrapping things up, we'd really like to just refer you to the part in our website that I had referred to earlier, signing up for email alerts. And it's very simple, just entering your email address, and you won't be bombarded with emails at all. And you'll get the latest updates and different products and resources that are being offered through the California Evidence-Based Clearinghouse for Child Welfare. So we really appreciate your time and joining us today. And please do not hesitate to provide or call or write us with any questions or comments that you have at any time. And we thank you very much for joining us today.